Welcome to the post hands-on hub at Therapy Expo reflection. And tonight I am joined by all of you, but also by our lovely Sarah Jones and Matt Phillips, and hopefully Amy, Simon, and Katie will join us, and other people will join us. But anyway, I'm recording it. So, and did I mention Matt Phillips?
You did.
I forgot. Yeah, I mentioned
Yeah, you mentioned
it.
it.
Exactly. Thanks God for that. So
I'm just glad Michael's here. Otherwise, I'm going to be mansplaining things.
Michael.
Thanks, Michael, for the solidarity. Good to see you.
Hi, Michael. Thank you. Yes, yeah. We need to do women in sports therapy.
We need to do men in sports therapy next year. You're taking over.
I feel that we ought to.
I tried to grow a beard, but it was terrible.
Oh, we can talk about that afterwards. That's the sort of struggles we need to talk about more.
Absolutely.
With men in sports therapy, things like that. I think it'd be popular.
So, the aim for this session is to catch up a little bit and discuss, exchange what we have learned from. Can we mute? I think I can hear. Can we all mute?
Yeah.
Let's have a look. Yes, mute. Yeah. So tonight, the aim of this session tonight is to exchange our ideas, what we learned that might change our practice, and in general, what we felt about Therapy Expo and Hands-On Hub. So the very important reflective piece that we at Therapy Expo at the Hands-On Hub provided with our little booklet, where we help people to evaluate and to reflect on their learning, their experience, and how as their experience might change their practice. So obviously I'm going to try not to talk because I'm really excited about this year's Therapy Expo, but I'm gonna everybody, first of all, please, everybody can contribute. So this is an open session for everybody to learn. But I am gonna start with Sarah actually, and I'm gonna see what Sarah, what did you felt? What were your experience this year at the Hands-On Hub and Therapy Expo, and what have you learned?
Well, from my point of view, it was a little difficult to attend too many talks because I was quite busy, but I thought the hub was a huge success this year, even busier than last year. I think we had a really good atmosphere. We attracted a lot of people. We had diverse talks. So in that respect, I think that was a huge success. And then I think, don't know what I've learned different. Sorry if there's any noises, it's my cat going mad. Anything that I've learned, I did listen to Ginty and Lou's talk about gender in healthcare. Bias in gender healthcare. Is that the right title? You know what I mean?
Yeah, the title was fantastic. It was "Don't Shush Me: Gender Bias in Healthcare."
In healthcare, that was it. So I run Menno cafes anyway, so it was refreshing to hear what they had to say, but also worrying with some of the statistics around how women are treated differently to men. So that was my top talk that I had a chance to go to sort of separately.
They needed something, isn't it? Because I remember when we were preparing, or we were discussing about the talk, they were saying they're gonna provide a visual
visual
yeah.
So it was like a big sort of scarf, but it was one color. I think it was red for I think it was in like a meeting or something when how often women talk compared to how often men talked. And most of the scarf was green, which is when the men talked, and there's tiny little patches of red where the women were allowed to talk. So it's quite. I think that was a setting. I might be wrong. Somebody might be able to correct me, but it was just quite telling.
It's scary, isn't it?
It's a little bit.
And in 2023, it is happening. Oh, that's great. And out of the session, what do you reckon? I mean, I know that you already do your menopause cafe, but what do you think as a practitioner? would you do differently because of that, Sarah?
I think I don't know if I would do anything differently. I think it's just sort of consolidated that I need to help women have their own voice. So, it's obviously not my scope to give medical advice, but I like to signpost women to the best care that they can get. And it's just giving them that confidence to have their own voice and sort of access the healthcare that they deserve.
And this is exactly what Ginty and Lou, when we discussed what the talk for them to present, this is exactly what they wanted, because they're not, as you all, I don't know if you know, but they're not practitioners. So yeah, Ginty is a fabulous yoga instructor, but Lou is a hairdresser. But what they're women, they meet other women, one in the yoga, one in the hairdresser industry. But also they went through menopause themselves. And all of a sudden they discovered that women don't have a voice. And because they're quite fun, they've been friends all their life, they got themselves behind the microphone, literally for laugh over COVID. And actually they realized that they felt privilege, that they realized that they became the voice for those people that they don't have a voice. And all of a sudden they are lobbying the government because we don't have a menopausal menopausal clinic in Devon Como, but also going around to GP surgery, engaging GPs on listen to that. This is what they want. They wanted people to say, actually, ask the right question. You might not do anything, might not be within your scope of practice, but show people that there is more within the suffering that they might need to be explored by somebody else's. Do not dismiss just as something, anxiety or depression. It can be more. Nothing wrong with anxiety and depression, but it can be more, and also appreciate the suffering for some people that come with it. So yeah, so this is exactly what they wanted, for people to understand it differently and to open those conversations. That's lovely. I'm glad that you managed to see that. Apart from that, you work like a workhorse, really. Yeah.
I was exhausted for days afterwards.
Oh, thank you. Mr. Phillips, good evening.
Evening. All right.
Yes, very well. You can hear who's got a good microphone or hasn't. And so, Matt Phillips, I know that you were very busy at the STA. The STA did very well as well, isn't it?
I think it's probably quite a similar experience, and the same kind of reward, which I'm sure you all felt when you could see it was bottlenecked and people couldn't get around. Every time someone couldn't get around, it was like, yes, job done kind of thing. It was just wonderful. And I particularly like our open air theatres for that reason, because you catch people who didn't plan to go there, which I think is one of the biggest problems in our industry, especially as an educator. You end up just talking to people who already know you, which is lovely. But if you want to help the industry change, you've got to reach people who don't know what you're going to say. And that's what our theatres do, because people are walking around and then suddenly someone stops and goes, they get that FOMO thing, don't they? Everyone's watching this, so I better watch as well. And even if they can't see the speaker, they're staying there. And I think that's a great way for education. So I think with the two of us there now, I like to think that we are reaching, a lot of people who don't know anything about us, because we are just drops in the ocean. I think it's easy just to think that everyone must know us now. Everyone must know the ST Square. Everyone must know the STA podcast. But I ask, like, each time, 100 or so people who are sitting in the theatre, how many of you listened to the podcast? Well, it was like Leslie putting a hand up, Nikki was there putting a hand up, the speaker put his hand up, but like the majority of people never heard of us. And it was really, I didn't take it personally. I was like, great, that's great, yes, because there's so much more work we can do. And I'm sure it was the same for you, a lot of people you've never seen before. So yeah, really good.
Do you think also that these open theatres are very good because there is, from the environment perspective, you're not on a stage, so you are telling people you're like me, or I'm like you, sorry, I'm like you, and it gives people the opportunity to engage with you in a very different way, instead of seeing them on the stage, with a big screen and so on. I do think that's got a lot, we are clinicians. Definitely. Ultimately, a lot of us that speak at those theatres, we are clinicians.
There's definitely parallels there with how we should or do work with our patients, because we don't want that. we're fixing you, we're at the top, we're physically or kind of like metaphorically looking down on you. We want that. You're going to tell me how to help you, sort of thing. I think that's what all of our great speakers, when I look at definitely my speakers in the STN, I think a lot of yours, they like that interaction. They want it to be just like having a coffee. It's coffee chat. It's not that old traditional, 2014 where you'd have some guru standing up there and then loads of people just going, wow, this is Adam Meakins, or this is Seth O'Neill, or this is, that's all changed now.
Some of that. We need some of that, but this is one of the things in the hands-on hub is for us to have the non-celebrity speakers.
I think it's pretty
healthy. That we know that they're great clinicians, they got plenty to deliver, and just giving them an opportunity, as we've been given opportunities. So sometimes we need to, for us, that we had a little bit, we are behind the microphone a little bit more often than in my case should, but to be able to give opportunities to other people that they have quite a lot to say, but they're actually just they're more or less their clinical practice is what really makes them great, and not being a speaker. So what do you think you learned this year from a clinical perspective that you thought, wow, that really surprised me, or I'm really pleased, I didn't know that, or anything that literally? I
think because of the diversity, which we both kind of celebrated and made available in our I was going to say hubs then, is that they're all called hubs now, in our theatres. I mean, I was just blown away by some of the conversations about working with the elder athlete, for example. Some of the stats which Michelle Lyons was coming out with, where like if you have a wrist fracture when you're 60, then that's increases the chances of God knows how much of having a further fracture when you're 70, and then I think it was a spinal fracture or something, and then or dying or something by the time you're 75. It was like real eye openers to do with populations who we just often are guilty of treating as the same as our main population. The same went for a lot of the menopause conversations and things like that. It was just, I think this year was definitely, for me, the highlights were just the diversity out there. We were learning about, we had I had Alistair Beverley talking about, working with learning and people with learning intellectual disabilities. So I think it was quite a proud moment for just, incorporating, like you just said, women not having their voice. So it was so nice the hearing 3 women up there talking about their experiences. There was such a connection. I mean, it's something men don't really get unless you're at the barbers. It's
I'm very stereotypical.
I think it's beautiful. I mean, I stand there, I'm just mesmerized by that connection of an audience of women talking to 3 women up there. I'm thinking men will never ever have this. It just doesn't happen. There's just a concentration.
Societal is we have to let's say get together. We have to join forces. Women have to join forces. There is
similar struggles.
If you read about people in the harem, that's they have to live together. To in order to overcome some of the restrictions. But I wish I would have been able to see some of the talks. Unfortunately, I couldn't, because I think we were busier, and I was engaged in many conversations with people. But I absolutely loved this year preparing for my talk. Not only the shoulder, the shoulder talk is something very passionate. So I delivered the shoulder modification. And you know what? I was so surprised how people didn't know about it. I mean, for us, this is bread and butter. This is what we teach in terms of shoulder assessment. And I had physiotherapists coming over and say, that's great. I said, surely this is 2006, actually, Jeremy Lewis. But apart from that, and people really received that very, very well, because it was clinically applicable, was something that, yes, I can see it working, I can see it putting into practice. We help them to translate a little bit of evidence into practice. But I'll tell you what, I really, really enjoyed my researching for my talk on touch. This is something that I've been working for a while. I've been in contact with few people doing some research, because we always been thinking about light touch and all these, touch needs to be light. But we know for those, for most of us for all of us in clinical practice, We know that if you say to somebody, what is the best massage? They will say a deeper massage. In fact, if you say, you know, why didn't you continue, you know, why don't you go to so-and-so? And say, oh, because the massage is too light. But also we know that some people with fibromyalgia or chronic pain respond differently to different type of touches. And now this evidence is coming up for it. And everything is starting making sense, you know, like why what we used to call myofascial release, or I call it myofascial work, you know, make people feel different when they get up. There is more of the kind of interoceptive awareness. And now there are, you know, some mechanism that might provide some explanation so that I can explain why massage feels very different from that type of strokes. I thoroughly, and I got so excited that I was running for people that were with me on the day, they will know that I actually changed the presentation until 10 minutes before I did the presentation, okay? I never end any presentation. I struggle to close. And I have to accept that. And so I was going into all my blah, 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 blah. And Simon there, Simon, you know, the chair of theaters, how long have you got left? 2 minutes. So what are you talking about? Surely I just started. So I had to jump 7 slides. 7 slides I had to give away, but to not do it. But apart from that, I absolutely love, I mean, this is me. So instead of going and like and say, oh, I love so-and-so talks, I didn't see anybody, but I love my own talks. So no, they were great. They were, I really enjoyed actually research them.
I'm interested. I just want to say, because I'm interested to see whether I got the impression, it might have just been confirmation bias, that it's difficult to say the average therapist in there, but I sensed that the average therapist walking around was just kind of, compared to 5-10 years ago, was just a little bit more on the evidence page, was a little bit more ready to receive something that contradicted maybe something they read or heard. And I'm interested whether you, Anne, or anybody else in here kind of managed to chat to other people and did kind of note that there was kind of I don't want to say a better level of education, but it kind of is that, just a more informed, you know, there are people who are, and that's I think just a really healthy, you know, way to learn stuff if you go there with an open mind. But did anybody have any conversations and kind of thought, wow, these people are really already quite clued up, or just thinking beyond just, I'm going to break down scar tissue, or the kind of stuff we used to believe and do years ago? Did anyone kind of had interesting conversations?
I think I had some conversations with a few people because after I did the hot stones and the pregnancy massage. So I think the hot stones, certainly it made people think slightly differently, because it's probably not something they considered. So that was that. And then pregnancy massage, mostly that was people saying that they found it refreshing that we were bringing it up to date. So maybe we had a few more in the audience for that one that were actually already informed, but actually it was quite nice that they were already informed, because that's not been the case online and what we see on a lot of the social media pages. So that was sort of the few people that I spoke to. That's what I found.
Definitely the audience this year, I don't know if it was because the audience was prepped for it. So like as Matt said, confirmation bias. So it's, you know, the same audience, but it was very, very different. I felt that the feelings were different. People were more receptive. People were seeking for those conversations, and or at least people were maybe not there for those, not understanding fully those conversations, but definitely ready to say, I feel that I need to update my knowledge. This is great because I wondered, you know, what evidence-based practice looks like, but I didn't know actually how to implement it practically within my practice. And actually what we wanted to do in the hub, especially with my first talk, especially, is to say to people, believe me, most of what you do is already evidence informed. What we have to get better is to understand what research means and the one that we need to look at and so on. But most of it, the client care, client preferences, and therapist expertise is very much part of our bag. And to be and I think people responded to the very positive messages after years of, you know, critical thinking that became actually cynical thinking. So I think it very, very responded.
I think we didn't tell people they were wrong. That was the big thing, isn't it? That's what we've seen over social media over the last, well, probably since COVID, really, is just that sort of very negative approach. So I think we just turned it around a little bit.
I think that was very, very meaningful. Actually, was quite the neurocentric based approach what went down really well. So the Paul Cocker approach, oh my God, people absolutely loved it. So how to introduce some more neurocentric views. So something that is coming a little bit into treatment. Well, it's been around the treatment for a long time, but people like that. People like to diversify a little bit. I know that you, Michael, particularly enjoyed that, didn't you?
Yeah, very much. It's sort of as you know, I sort of play with it a little bit, but it just opened up so many more opportunities. And yeah, I really and I realized that actually somebody goes on longer than you because you had to stop him.
I mean, he went over 10 minutes. I am very respectful, of my next speaker. He went
I
over
saw
10
his
minutes.
first talk as well, and the guy said, "You got 2 minutes," and he just carried on. But
Welcome to
there's so much to cover. I mean, he needs to cover the bases and then show. But I just really loved the approach, and yeah, I've signed up for the course.
Those are simple strategies that, again, we need that can be really implemented as part of the bigger care. And talking about that, one of the things that went down really, talking about the broader care, something that went down really well, I'm still getting messages, was about the final panel discussion with Amanda, that she was the MSK consultant. She's the MSK consultant and the one who created the MSK conference inside Therapy Expo. And she is been working within education and IHAP in the NHS. And we had this really good discussion about our standards, because obviously we all know where our standards of training is. And she's, I thought there was some meaningful conversation. However, and I still, I'm a dog with a bone, kind of. She still didn't understand what we do, because again, she continues saying about massage. Oh, we like massage as physiotherapists. Every physiotherapist like massage therapy. Or when I did my physiotherapy degree, we spent a month learning about massage. To which we had to say to her, Amanda, massage is part of a strategy for the wider approach to care that we provide to people with in pain or with injury. They still do not understand that actually we are not just a modality modality-driven therapist, but we are, and we should be seen as caregivers, providers. So that also went very well, and that's how Paul or James Earls or all these they bring in those approaches. Those approaches are all part of strategies to engage the clients to move better, to move pain-free, or to just give them opportunities for change. What did you find? Some of you were at the panel. Diane, you were at the panel, didn't you? What did you think of that?
I loved the panel. I did pick up on the kind of the month training. I thought that doesn't sit with what we're actually saying here. Kind of that comment was like, well, I think that's when I was kind of thinking, well, actually, that kind of confirms you're just a masseur kind of thing. You just do massage, and that's obviously which I raised at the time. But I love the idea that there's more thought being put into standards and to how we validate what we do, and therefore give the credit to it, and that means it's more accessible to people, hopefully, because it's not just something nice to have, it's actually something that has a value and has a result. We know it has a result. So and that there's people interested in the future and changing it. So
this is
So there's some drive.
This is what me, Sarah, and I'm sure Matt felt as well in his theatre at the STA, that there is just this need, isn't it?
Yeah. And picking up on Matt's point, I think it felt very much this time that you were spoken with rather than spoken to. So, yeah.
I think that's a really important point, and I think that's the similarity I saw between the speakers, you, Anna, and myself. And I think it's really useful for education. And like Sarah said, the last 2 years, there's just been a real polarized going thing on social media that's not healthy, and I fear that a lot of therapists have either left and gone running because they just thought, oh, I'm crap, all the stuff I'm doing people are saying is wrong, or it's just been a mess. And I like to think this year that peaked a while ago, and this year we're coming back from that, as is always the case in life with peaks and troughs, and we're saying no, it's kind of, we're just helping each other here. We're on the same level. You're going to teach me things by listening to me, and I'm going to, and that's really healthy, because that's the same thing we should be doing with our patients, clients as well. So I like to think I saw that. I worry that I was just imagining it, but I definitely think I felt that.
But this is why also we wanted to have we wanted to bring back a little bit the like, for example, I absolutely love James Earls and what he teaches and how he presents it, because, and we did a podcast with the Massage Collective years ago about talking about the BPS and talking about the biomechanical part with sense and sensibility, kind of. And James brings exactly that. James brings, and the same for John Scriven, which was, a newcomer into our circuit, kind of bringing in the biomechanical efficiency, the importance of the biomechanical efficiency, because a lot of people felt so, let's say, disillusions, or felt that they were so wrong for looking at biomechanics, and what they understood that it's not, biomechanics is one part of the risk factors for pain and injuries, is one risk factors, though, amongst many others. But actually, and I love, we said we re-own the word moving well, we re-own the word holistic. Those are words that we need to bring back into our vocabulary, because actually there is a moving well. We can move well, opposing to moving, in a without variability. So it's that those nuances were lost, and I think people like James Earls are bringing those nuances back and telling us, actually, guys, do you know what? Your big toe needs to extend at a certain degree, and lack of that extension will create changes in efficiency of movement that might never create pain, but changes in efficiency of movement. So that then if you add onto it ligaments which are tendons which are a little bit pissed off because of menopause, which you add to it the fact you haven't sleeping very well, which you add to it extra load too quickly, too soon, could there be risk factor for pain? Of course there could be, So bringing the biomechanical anatomy, integrated anatomy, back to the discussion. The other things that we spoke when we wrote down about the story and the 5 principles is this hierarchy. Let's stop about talking about one system being bigger than another. The BPS, it's an integration. The same is the nervous system is not above the muscular system or the circulators. Our psychological being should not be put on top of our physical well-being. We are one. Everything is interrelated together with the bloody environment. So, something that is, we need to see it. We need to see the person we're working with as a person, not as the joint, not as the neuron, not as the brain, not as a person. And that's it. That did it came out as a rant? Sorry.
How do we treat a person, isn't it?
Yeah.
Not how do we treat a shoulder, not how do we treat a brain, not how do we treat how do we treat a person, and what do they need from us, and how can we help, and how can we get other people to help them and send them to
And
other places, and it's a start, isn't it?
and that's why I think holistic, and I'm sorry that Imi is not here now, but Imi, she's a big driver of that. We want to bring back those more spa holistic type of therapies into clinical practice. Because what do? They make you feel better. And feeling better is the basis of everything. If I feel better, I bend the toe more. Therefore, when I go and walking, I get more variability of movement. You see, so everything goes back ultimately. What does the person feeling better with? Some people will feel better if I actually just hands-on and general touch or massage them. Other people, I need to do more mobilization with them. What do they feel better with?
Well, we brought two holistic therapists with us, didn't we? We brought Evie and Rebecca, who's Indra's friend, and they come from that sort of level 3 holistic massage, and they were a bit worried that it was all going to be over their heads, and they loved it. And they just said, "Oh, hang on a minute,
Lip service.
we help people."
Let's take in.
And this is, I think, where we should be sitting. You know, we should be broadening our understanding of what health and healthcare sits. So it did what the other people that they were there are here, what is that, if I say, what is one of the things that you picked up of new that you didn't know before, and you think, oh, do you know what, this is going to change how I do some of the things in my clinic? Is there because I didn't see any of the talks, unfortunately. I will get some of the PowerPoints, but I didn't see any of the talks. So is there anything that you learned that you can share? Indre, tell us what you learned. Have you learned anything that...
Yeah, I did everything probably from Paul. Yeah, because he totally blew my mind. I think so Michael's too. It wasn't too new because some of the bits Paul said, especially with all the eye movements, Mel taught us on level 5, but Mel didn't necessarily explain any of it behind it, but he already knew how to do it, you know. And to be honest, I literally forgot that part until I saw Paul doing it. I said, oh yeah, right. Oh, now that makes sense. So let's do it.
But what was that about?
So basically moving the eyes, using eye as a muscle to improve, you know, improve your flexor tone, improve this. And it was just great. I already started doing it since Friday, you know, when I came back to work on Friday, say, okay, let's do it.
Yeah, Raddy used to do that. Raddy, who kind of devised the pulse in MET for people with neck pain. If they cannot move the neck, like think about somebody with torticollis, instead of rotating the neck to do an MET, you just ask them to rotate, to look with the eyes where they want them to rotate the head, and those muscles will then activate, and then they can do a nice MET with that.
This is it. My favorite was, because I couldn't remember half of it. It was what Paul said. If you can't tell them anything, just tell them just to look at the thumb and concentrate your movement on the thumb, then just shake your head a little. And I said, that's it. That's what I've been telling people. And they looked at me like I'm stupid, my clients. But I said, just try it. Just do it. Just go on.
I love
and
that.
yeah.
I love these things.
Yeah, I loved it. Paul was great, probably from all the talks, and we've seen quite a lot of talks. Yeah, I think so. Paul literally done it, hence why we booked it. So we're gonna come to Devon. We can't wait. It's great. Finally.
Wonderful. Wonderful. So who else has seen something that you really, really enjoyed and you can share with us?
I didn't see all of it, but Matt's talk on because I was coughing all weekend, so I kept on disappearing all that week. So I kept on disappearing. But Matt's talk on gait analysis, something that I'm
surely not Matt.
Very sure. I'm very sure that I've always been very sure that I'm not really interested in it. And then it made me think, hang on a minute. there's a lot I can get from this to use in the room. It doesn't have to be for the runners and get their gait and their whatever, but it was just really interesting. And how you could actually integrate that into, doesn't have to be a runner or anything. I know a little bit about it, but it just, and then after listening to James's talk, and I've got his books and I've read those, and then thinking, well, actually maybe I'd like to do a gait analysis course, but not for the reasons, not to necessarily offer gait analysis, but it's another thing to learn and add that can help me. So things that you're not that interested in, maybe you'll still get something from it anyway, and that's what I learned.
It's really cool to hear that, because in my gait analysis course, we don't really do a lot of gait analysis, but don't tell anyone, because that's the only reason they sign up. No, it's not true, Sarah. It's not true. No, but it's really nice to hear, because in the gait analysis course, a lot of it is, okay, here's what gait analysis isn't about. But that doesn't mean stop doing gait analysis, people, because you've got a runner doing something they love, being on a treadmill with their ears wide open. So then they might well start listening to the other lower hanging fruit, which we need to talk to them about. So it does apply the same way as that's one of the greatest powers we have, by letting someone just chill out and relax face down on a couch, because then they are going to start listening. You've got that therapeutic alliance. So I think that's one of the massive powers of gait analysis. There is other stuff you can do, like kind of gait retraining to modify load and all that sort of stuff. And we can tie in certain ways of running with which we know stress certain tissues. So there's a lot of that. But again, it's about, I think one of the things, listening to you guys, I just want to say it before I forget it. I think the sign of a good conference is there isn't something new. There's not a new acronym. Once upon a time, every therapy expert would have to have something new. This is the brand new system. This is now, don't you do ARGT123 stretching? Or don't you do PED216? It's like there was always invent the wheel again. And I think one of the nice things about Paul Coker, that's the essence of my gait analysis course, is I'm not teaching anything new. I'm just trying to frame it in a way which gets through to people. And I think a lot of the things, like Greg Lehman, I read about probably 12 years ago, saying what I prefer to think of it is, I don't work with different types of running injuries. I work with different types of runners. And that was like, wow, that just gets it in typical Greg Lehman style. But a lot of the other stuff which Greg does, no disrespect to him, can rub people up the wrong way. And he's getting even more cynical in his old age, and it's just turning people off. So a lot of the stuff we're talking about now, so it's working with the person and not the actual injuries, has been said since probably the late 90s by people, even earlier. But it's about education. It's about getting that through to us, first of all, without us feeling really disappointed and throwing everything out, and then us getting it through to our clients who are surrounded by the same kind of misinformation. I think for me, that's what this year was all about. And when Indre said that, I did that before with Mel, but it was framed now in a way that I understood, and that's like magic. Yeah. And that would be music to Paul's ears. And that's what should happen with our patients. We're going to tell them the same things which they were told by the physio and the chiro and the osteo before us, and the other sports therapist or the massage therapist. We're not going to invent something new, because the truth is kind of pretty simple, but we're going to frame it in a context, in a way where they go, yeah, I get it, I'm going to do that, I get it now.
That you absolutely hit the nail in the head. It's about the contextualization of the knowledge. I think people all a bit fed up to go to conferences, get full in of this amazing knowledge, but actually, how do I apply that? The knowledge learned in half an hour into tomorrow with my clients, because actually we are all very busy. I haven't stopped treating since I came back, all very busy practitioners. Instead, if we provide those spaces where we do a little bit of contextualization for them, so we give them snippets. This is what it looks like. This is what you can do with the knowledge. You're changing the game completely, isn't it? You are just, and then they're going to be even more interested and then research even further. But first, let's show them also how do they use the knowledge in the practice, because that's ultimately what everybody were there, because they wanted to be better for their clients.
I think it's
muted, Sarah.
Yeah, she muted me. Rude. I think it's about disseminating that information, or drip feeding it to practitioners and therapists in a friendly way. and like Anna said, in a non-complicated way, because we can overcomplicate these things, and it just seems like it's an unapproachable method of sort of delivering education sometimes. So I think if we're a little bit gentler about things, we get less pushback, and then people accept it more, and then it drip feeds down. So then it comes down to our clients, and then hopefully eventually we'll stop getting all these silly myths and silly sort of thoughts around injuries and pain and all these sort of things. Just my thoughts on you.
I think it's really important as well, and that's filtering through. It's about, when we talk about working with the client, it's not about saying to them, this is what you need to do and this is what you should do. And it's not, how is it that Gary Mendoza, don't at them. What is it he says? Don't.
Well, that's
You
some
remember
people
that.
some people just need a good listening to.
Yeah, that as well. But there's something that he says
He
as
says
well.
so many good things.
Yeah, you
Yeah.
cannot do direct, you need to do not direct talk, you need to do change talk. So you cannot tell them what to do. You need to ask them about, finding the different option. Don't act, but, help them to, don't let them, don't tell them.
Yeah, so when we're having communications with our clients now, it's not to be the person here, and we've said this already in this chat, not to be the person here passing on the information. And I think,
correct.
Yeah, and I think that's really changed how I work with my clients, is the motivational interviewing bit. And I think now we get into a point where the people who are delivering the courses, are they getting to the point where they're delivering it more with the learner in mind, as opposed to, I'm going to tell you. And so are we all kind of joining in a little bit more? Are we going along with it a little bit easier, which makes it easier then to relay to your clients? There's a word there that I couldn't get, and I'll remember at some point.
Is it where he says don't should at people?
Yes.
Yeah.
Yes.
Tony Robbins says it as well, and he says, so don't go shoulding all, and he says it about yourself. Don't go shoulding all over yourself, because it gets messy. Don't tell people that's what they should do. That's
yeah, absolutely. But this is one of the biggest thing on motivational interviewing, the directive talk. We know it doesn't work, so it gives a backfire effect. What we are there to do is to help them, and like Lennox Thompson says, I love. We are there to help them make sense, joining their own dots, because those dots belongs to them. Instead of us telling them something, those dots, belong to them. Even at the point where it says, instead of saying, oh, don't do those exercises, or what exercises do you think you could be doing while we're decreasing the load? So even things like that, absolutely. And I think people are more, Leslie, you're absolutely right. I think people, they realize that they're not anymore in the paternalistic healthcare system, but they are more into a person-centered system. They're not an interactor anymore, but they're just somebody like, we are, like Matt said, like we were in the stands where everybody is the same level. Education, I hate the word education in healthcare, because me educating my patient, my clients, means that I know more than them. No, I know differently. They are the one educating me about their lived experience. I might help them to explore different options, but we are, I think is hierarchical and not hierarchical.
I think we saw evidence of that. From Leslie was saying, are the teachers being like that now, as well as the therapists? And I think definitely we'll see this, as Matt said earlier, we'll see it through our lens, and we're hoping to see that. So I think we definitely saw a lot more of that this year, and I've no doubt it's real. But I did see evidence of still the old style, reeling out the old presentations, filling the theatres and having to turn people away.
I was going to, Nikki, I was going to ask, because last year I was sitting, was the talk before mine, and I kid you not, full theatre, and I was listening there, and it actually came out of my mind. I thought, am I sitting in 1985 in a theater? And the people in front of me, they turned around. She said, yeah, you said, we just were thinking the same.
Oh, you actually said it out loud?
Oh, yes, I actually, what? And the people in front of me turned around. She said, oh, we were thinking the same. We're two physicists. I said, oh, you know, blimey. I mean, we should know better. You know, we should.
Yeah.
But the theater was full. I kid you not, was one of the, when I got the leads from Therapy Expo, that was the biggest sessions of the 2 days last year. So I'm looking forward to see what it was this year.
Yeah, me too. There's so I can think of 2 examples this year. One was Owen had gone in to scope out Theatre B just to see what the layout was so he could prepare for his presentation. And they were doing some demonstrations on some equipment. I think it was the ones who were sponsoring the theatre. I don't remember who it was.
Yeah,
and it was packed, and it was just really old kind of structural analysis stuff. And he was like measuring force, but in a like force output, but in a really like non-functional position. So he was gobsmacked that was still that people were still kind of like, you know, writing down notes for that. And then I've seen, I won't mention who, but I've seen on socials since somebody posting about how successful their time at Therapy Expo was because, you know, as expected, as always, turning people away at the theatre entrance. And I walked past their talk while they were doing it, and I just thought, did exactly the same last year. Just reading out the same old stuff. So
yeah.
I definitely think there is a lot more of what we're talking about.
And yes,
there
and
is still some of the other stuff.
I'm interested on reflection, what you, Anna, and other people working in the hub feel could have been better, because that's an important part of reflection as well, isn't it? What do you think the hub could have changed? You know, what could have been done better or differently, or?
So I must say that in terms of talks wise, we could have get better feedback from the audience in order to get them hands-on. So I know that feedback from last year was they wanted to get hands-on, but then actually when you were into the audience there, they didn't want to get hands-on, because I think it's being an open theatre, people felt a little bit awkward with it. So I think we ought to have rethought the environment around it a little bit better, because I'd really quite like to have a proper hands-on. And again, but I don't know how to change that. It's creating a more interactive with questions talks instead of just delivering the talk, but because the talks are so short and we explored the idea. I loved what Amy and John did. John did the theory part and Amy did the practical part after. However, not everybody likes our talks because they want to go and see other things around. So it's something that I actually we need to rethink for next year.
Anna, one
yeah.
of the things that, obviously it's only my first time going, that I was thinking would be quite good is to having that opportunity for you to go and actually speak to some of the people on a one-to-one basis.
So
there's so many people that spoke that I would have liked to have had a chat with, and it's literally like in the big theatre, it was like, okay, you can have 2 seconds, you've caught them at the end, no one ever had time to ask any questions, information was just loaded at you, and then you go away and you take that on board as best you can, depending on how good you are, I suppose.
Yeah,
utilising that information.
So Laura,
been made better in yourself, couldn't
so
it?
Laura, actually there was this year an area, but it was decided very much at the last minutes, and we did. So you know where we actually used it for our storage?
Storage.
That storage where that sofa and everything. That was called Meet the Speakers.
It was supposed to be a big sign and never turned up. It was supposed to be a big Meet the Speakers thing, which never happened.
They you know, both way, but we know this is good that you say that, because this is something that actually me and Matt pushed a lot. So for us, the STA, and actually was Rehab My Patient, to have a common area between those 3 stands where people, like let's say you're finishing talking you know, Paul was finishing his talk, then he could have migrated over there and then chat further with, you know, one-to-one. It didn't work this year. It was great because it was a spill out area for our two big stands, the STA and the hub, and that worked for us because we had an area where, you know, we could a moment draw back. But there are a couple of things. One is that, and my other big thing for next year, one part of the meet the speakers, I want headphones there, noise stopping headphones for people, neurodiverse people, where they can read, anybody that they feel a bit overwhelmed, because there was a moment where I just couldn't cope anymore. There was too much information overload, and we need an area to come out.
I couldn't concentrate because there's too much background noise going on at times. There's other people there. It's too much for me.
Correct.
I actually did wear the headphones that were there for a couple of talks, and that really helped. But also for neurodiverse, I've got the Loop headphones, earplugs.
Yeah.
And I had literally just come off the train, and obviously it's kind of like an experience in itself, being on the train, and then getting into the conference, and your shoulder chat was the first one that I attended, and I put my Loop headphones in, and it was like me being a different person being at the conference, because I was like, I could hear the background noise was still there, but it was turned down a bit. Yeah. And I could really focus on what you were saying. But the headphones that were there were really quite good as well. Although at one point I put them on and I could hear Matt, but I was at your I had the wrong headphones on. I was like, ooh. But this is something that I was thinking about as well, that it would be really nice to have an area for people who are neurodiverse.
So we talked about it last year, and I thought Shelley was on board with that, but then I don't think it was taken on. So I took my responsibility next year to do it. And even if they cannot give us a closed area, I seen it done where, you know where is the meet the speakers, you can have just a couple of bean bags, really nice, let's call it wallpaper. So the people put the headphones on, which are completely noise cancelling headphones. You just sit down, look at this lovely, you know, screen or whatever it is, where you just take a moment to decompress. It's just 10 minutes decompression. That would be very, very good. But also the meet the speakers area where we can have the one-to-one discussion to bring, because me and Matt was really a driver on that this year or last year, that, you know, we found that it was too much going from one talk to another, and no time to do anything, no time to talk, no time to, and so, you know, that question is being raised several times. So next year we'll make sure that happens. So yeah,
I would quite like to support that in any shape or form that I could for next year, if there's anything needed in kind of like a neurodiverse space. Then
so next year on our stand we're going to have quite a lot about neurodiversity. Quite a lot of talks on neurodiversity as well, because it's something quite passionate about.
And looking at next year as well, what I'm really interested in, and this is obviously just very self-serving because it's where I'm at, I'm really interested in ADHD and menopause.
Yes.
Because when the two clash, it's like, whoa. Because I've always thought I was neurodiverse in some shape or form, but in the past few years, when I've really ramped up into my menopause, even though I use HRT, it's been much more, okay, hang on, I'm going to have a look at this, you know, and it's definitely been the change in hormones and the drivers. So for me next year, that's something actually with Sarah and I spoke briefly about, because you were wanting to do some stuff with Womankind Collective as well, weren't you, Sarah?
Yeah, I think we were on one of the many forums, weren't we? And I asked a question from one of my clients, so we got chatting on there. Yeah, it's a big thing, very big thing.
Yeah, definitely next year about ADHD, quite big, and other type of neurodiversity, because it links very well with touch and the other bits and pieces. So without giving too much away this year, but definitely it's a mass for me. It's an absolute massive must, especially because, as you can all see, medications have been short and I'm walking up the walls as neurodiverse. So yeah, great. Matt, if I turn the question over to you, what do you think you would have liked to have done differently at the STA? Or even at the hub, mate, even at the hub, you and Sarah, you know, what do you think it would have been different at the hub if you could have?
I don't know, my initial one was like, you know, why when I spotted there was not many people around, I was thinking, right, what's going on here then? Is it something we can control? Or and I thought maybe it's because you've got, I don't know, the Mike James or the Claire Minchell or the somebody going on who people just pack out to see. Is it because of that, you know, or and I meant at the time to when I did see a quiet moment in either of us to kind of do a little run around and have a look if there was an external factor, just purely from are we missing something here or what's happened, or is it the content? Because it's difficult to tell, isn't it? It's always multifactorial. So because there were times where my heart went out because I walked past. I think it seemed to me, I'm not quite sure here, but it seemed to me that the quieter ones for you was when you had a couch out and someone was doing something to somebody on the couch. To me, that seemed that things are quiet. I was thinking, oh, that's interesting. Why is that? Is it because it's clashing with something? Or is it because people think, oh, they're just doing a massage there and people are just watching? There's not much content there. But I did notice that at the hub. I don't know whether I just saw it 2 times and imagining it more. But yeah, I think trying to work out somehow why some were quieter than others. I did make an effort in the STA theatre too. If it was a quieter one, I said at the beginning, it's great that there's only 20 of you here because it means we can really interact a bit more. And I checked the speakers beforehand. So I was running around with a microphone and getting that spontaneity and having the 2 Chris's answering questions and kind of just, and people really liked that. So I thought if there was only 20 people there, those people are going to think, wow, I'm really glad there was only 20 of us here because we really got some inside information. It was personal. So there are advantages to having less people. So I think working on that a little bit, if it is a fact you can't control, then suddenly being able to turn it around and make those people feel really special and make them think, wow, I like the quiet ones, you know?
Yeah, for us, it was the 2 talks that we had to literally, one of them we had to make up on the spot because somebody let us down at the last minute.
Oh yeah, no, that's like that
yeah,
to me as well.
The timings was not quite right, and literally we had to just jump in. I think it was me and Amy, and you know, without rehearse something that you know we know quite well anyway. But so that was, yeah, that was interesting. That's really interesting because I always at the beginning on my first talk I thought, nobody's going to turn up to listen to me. Nobody's going to turn up. And you know what? The one that I wish there were more people on, it was Owen Lewis.
The one on Thursday morning.
The Thursday morning.
Yeah.
I wish there was more people because, you know, critical thinking, it's a really important skill set that people don't yet consider it important. And it was not flashy, you know, it didn't have a flashy title. It was
intended to be a lot more interactive, which we thought would work really well on the hands-on hub because you're on that same level, not lecturing.
Yeah.
People there, and but I think that one, I think it suffered from the time slot. First thing Thursday morning after the Wednesday night piss-ups. Which, you know, we have to accept that that happens, and we're, you know, often involved in them. And also, I don't know, because it's on the one hand, it was really suited to an open air thing because it was, you know, wanted people wandering in and stopping and chatting with each other. But on the other hand, it was a bit difficult because there's this distraction of people walking past and stopping, and you know, it's kind of like, well, should I turn around and I start having some reflection with this person, or oh no, they're going to walk off? And yeah, I don't know what the solution would be there, but I felt that as well.
Sarah, what do you think?
I think like Matt said, I think some of it is clashes with some of the bigger sort of well-known names that people will always flock to. It's interesting what he said, excuse me, about the practical sessions maybe looking a little bit quieter, because that's obviously the anti of what we want to achieve, because we're the hands-on hub and we want more practical elements. So we need clearly a rethink on how that's delivered, or
I think that's interesting.
I don't know.
Yeah, I think if you can master that, then you will have cracked something, because I think as people are walking around, people still saw maybe, because there were still people walking around, and when they see somebody doing something to somebody on a couch, they just automatically assume, oh, that's just going to be they're showing some technique. And actually, maybe it's actually quite a good thing that they did walk past. Maybe they've got this, but it's almost backfiring on itself now, because people are going, oh, I don't want to see some new STR technique. I want to learn about communication or something. And they don't realize that what's happening in the hands-on hub is, yeah, we're doing this technique because that's what you're going to be doing on Monday, but you've got to listen to what we're saying whilst we're doing it. We're not just showing you a new,
and this
kind of
is
stretch.
what went down
I don't know how you
really
do that.
well with my talk at the Rock Tape. So I did the same techniques, the usual, what call it myofascial work down to the back, but I was explaining the mechanisms or how to explain it to a client why the person feels better. And that all of a sudden, oh my God, yes, that's great. You know, we have a vocabulary now to explain. So yeah, that's great.
Maybe there's something as simple as, if when the demonstrations are going on, having something really, really clear on the screen behind you that says, this is what's happening right now, stop and watch.
Yeah.
I think
Yeah.
being able to see on the screen, because you couldn't see what was happening on the couch when you were in the audience at the hub, whereas
I
the
agree
Rock
with
Tape,
that.
when somebody's working on the couch, generally everybody's much more spread out around the outside.
You're
And so I
absolutely
think that's
right,
part of
yeah.
it. But having a bigger screen for lots of the slides would have been really useful, because sometimes you couldn't see the content
Diane,
of the
you're
slides.
absolutely, this is something that is in my agenda. So our AV system, both the screen and the audio, was not the size for the hub, for the space. And I thought about the camera for next year, camera linked. So this is something that I'm going to be requesting for us.
That's a really good point. Yeah, a bigger screen to show close-ups of what's going on. And also maybe the person, maybe having a kind of a two people doing it. So the person who is doing a technique or something is doing it, and then somebody on the microphone is walking around, and just so they realize that it's not just somebody doing this, there's somebody talking and explaining and moving around, interacting. Maybe that would kind of get people in. People go, oh, what's he talking about? What's she talking about?
Yeah, that's was last year. That was what we did last year into the massage therapy show. We literally, every technique, so every different type of touch we explained, and with the slides behind it. And we thought we did it last year, you know, that surely there is no need for this year. But then again, you know, people that have seen it last year, they would not come back this year, but new people would have seen it this year. So this is something that is going to definitely return.
I think also coming up next slide as well, I found that in the STA that people are walking around and almost like thinking, what shall I have for lunch, or what shall I have for the afternoon? And those kind of digital things they did were quite small. I think if there was a big screen with a photo of the person coming up and the topic of what they're going to be doing, you know, next up, even during a talk, having another screen where it shows up at 11 o'clock or up at 11:30, because I think sometimes people are planning what they're going to do as they're walking around.
It would be
like
great if you could have like when you walk into a big railway station that's got all the trains going on. It'd be great if you could actually have what was happening in all of the places easily available. Because just trying to work from the program,
that's a lovely idea.
The app's great, but actually, again, it was really hard to plan what you were doing, and lots of things you wanted to see clashed. But actually, having a huge, as you kind of go in, this is what's happening on this station. This is what's happening on this station.
That's a lovely idea.
Would be amazing. So
at the front somewhere, people could go and like arrivals and departures. They could have a look at. That's a really nice idea.
And who's doing
the scar tissue ones were very popular.
Do you know what?
That's probably because people are looking for what they can do for an outcome, rather than what you're talking about is the outcome is the interaction. And not everybody's sort of there yet. So they go, oh, we get a particular outcome if we do this in a certain way. Whereas what you're saying is let's move away from that to an extent. So maybe that's why, so scar tissue, we do this, we do that, and it was very much about that, because I had my stomach treated in one of the other things because no one get their scar out. So, and it was very much about do this, do that, and it will. And where you're saying, actually, let's treat the whole cake, not the slice, and it's still a bit alien to people. So
yeah, but still, I do.
They'll get there.
Yeah, I do particularly rate Emma. I think her approach to scar is good for people that work extensively. For people that work extensively with mastectomies or big scars, there is a need to know how we touch scars. So that's why I think there is a space. But not, Talia said something really, really interesting. She said the rock tape stand where it's always hands-on, is always packed. You know, there is, because people do like that, but we have to find a fine balance. I think we got the balance between the talks, you know, between these more general talks and the practical applications. I think we need to find how better to interact with the audience.
Could it be as simple as getting your bench, you know, because I like your space because it's really versatile, and you can put, so when Amy was doing all the movement stuff, you put benches around the edge, and if you're doing couch-based stuff, it may be that you just push the benches to the edge, bring the couch from the front to the middle.
So we already had that. So we had, the thing is how you engage the people there. That was the difficult part, because we already had it planned, all of it, to be hands-on. Once we went there, we thought, ooh, we had to change our plan, because we thought people are not going to engage. You can already see it. So
I can tell you that for future, James and Owen are already thinking about your two areas. How can we make the talks that we do there, if they're invited back again, to more practical, more hands-on, because they really want to take advantage of that space.
Yeah. So yeah, that's a good thing. That's very, very good thing. So I didn't realize the time, because I would have gone on forever here.
No.
No. Oh, Friends, isn't it? Does that? There is no respect anymore for Friends. So let's anybody had any views or anything that they wanted to add to it?
No, I just thought I might say to Nikki, I really enjoyed Owen's chat that morning, and I thought actually it's a really nice coffee time kind of chat.
Yeah, it is.
To try and maybe there's some what's it in having kind of coffee time kind of chat. You know, that's the time in the morning when people are more likely to chat. When people first arrive, they probably don't want to engage straight off. They want to absorb. So the same as you'd lesson plan as to when people are receptive to stuff.
Yes,
and having proper hands-on stuff to stop people falling asleep or kind of not being able to pay attention to a more serious lecture in the afternoon and that sort of thing. Just thinking about actually how do you deliver and when you deliver. The different types of sessions. But I've got a picture of the slide with all the questions on. I just loved that, and almost needed longer to process.
Yeah,
the
and
answers and the discussion.
was very happy to discuss that kind of thing in the speakers' corner. I think Laura was there. Was it Penny? Is Penny here today? She was, somebody got after one of Owen's talks on ribs. I think it was Penny came along and got him to do a quick assessment, and very quickly, and that was in there.
Would have been Sal.
Was it Sal? Okay, very quickly. Quite a few people, mostly like your guys from the hands-on hub, all kind of built up and around. And Owen was like, "Well, do you think that's the kind of thing that might be like have people interested on the hands-on hub next year? Is more of a practical. This is what we would do. This is how you're getting. Do you know what I mean? So it's less scripted and more."
Yeah, but this is some of it is exactly what it was in the plan. So we could there was going to be a session on Achilles tendinopathy and how we can treat it, but then the timing. So this is all things that is great to hear, because it's it's what we part of it where we want it to be really. So that's brilliant.
It was still the best two areas in the whole place, and I know I'm biased, but I did go around all the rest of them as much as I could while I was working. And to be honest, there was only those two places, Theatre B and one in Theatre C, because that's where Paul was, where I was actually interested in any of the talks for my own personal. I
would have liked to listen to Claire Minshaw.
She's too in depth for me. I so admire that woman. I think she's amazing, but just because I have not got a practical application for the immense amount of knowledge she's got on rehab. And Sonia Fiere's, I loved hers in the STA theatre as well, and just got this appreciation of just how broad the whole field of flexibility could be, and how how specific she can be in training different populations to improve their flexibility. So hypermobile would be different than somebody post-op, and I just thought I'm never going to, personally in my practice, I'm never going to want to specialize that much, but I've got so much respect for those people who do.
They're fantastic. Yeah, both Sonia and Claire, actually, I think Yeah, fantastic. So yeah, all in all, I think it went very well. I think we are there is a community now, I think, and Gary Benson, Matt Phillips, Sarah, Amy, and all the others, all, you know, Nikki and so on, and James. There are so many names, and I don't want to leave anybody out. There is a community that has been created. It's a safe community, and I think we are a little bit responsible for this positive feeling that we all got from Therapy Expo. Many things needs to change and many things can be better, but I think we are the responsible for an industry that is moving towards where it should be moving, and that actually provides care for the clients we see. So I feel so excited as I never did before to be, after 25 years being in, well, I'm sorry, after 22 years being in the industry, I am excited so much about where we are now. So I think it was everybody's success, really.
Yeah, I do. I agree.
Yeah, definitely.
So I think, Sarah and Matt, would you like to, otherwise I'm never going to wrap up.
What, carry you away?
Yeah, it's a good point. Should just keep going forever.
No.
I mean, I think we can always
close questions.
Yeah, we do, don't we? I think there's always room for improvement. We could say that year on year, there's always things we can improve. But that, you know, we learn from being there each year as to what works and what doesn't work. So I think it was a roaring success this year. It was better than last year, and then next year will be better than this year.
Good time, definitely. It's good. Yeah. Can't think of anything to say after that.
No, you guys deliver definitely. Like for us, for few of us who was the first time when we walked around, it was pretty easy to choose. You look at the program, right? Hands on hub. Yeah, okay, stay. Yeah, okay, this is it. It was only very few we done in a theater, so like in other stands, literally 1 or 2, because it was just easy to choose. We know where to go. We know our people. So you really delivered. It was such a positive feeling.
Oh, that's brilliant. And next year it's even better. You know, some of the plans we already have for next year is just gonna blow the house out. Honestly, what you think about conferences, just you got to rethink it.
Nice.
Okay, everybody. Listen, thank you very much. I hope people found this one informative. I certainly enjoyed it, spending evening with friends, I would say. Thank you very much for all the old people that they are followers, but the nice new people that they're coming in now. Some of them trained, some of them just met from the Expo. So it's great all being part of this community. So without further ado, I leave you and I love you, and catch up probably sometime soon in the future. Bye now.